So when Joshua Sharfstein took over as Baltimore's health director, he realized that something wasn't right. 4 childhood fatalities in the city had been linked to cold medicine. Sharfstein, a licensed pediatrician, knew the risks from giving small children cold and cough medicines weren't worth it. Studies had showed no clinical benefits to giving the medication to children under the age of 6. And he just didn't understand why nobody had done anything about it. So he decided to do something about it, and he decided to do something ambitious and to tackle that problem, and not just to tackle that problem in Baltimore, but to change the way the country as a whole thought about these medicines and to change policy at the national level. Sharfstein recruited some of the nation's top pediatricians to join him in a campaign to question the safety and efficacy of the medicine. The campaign worked. Suddenly, the subject was in the national spotlight. The cold medicine industry voluntarily pulled off the shelves some of the medicines that it had previously claimed were safe for children under 2. Even more remarkably, Sharfstein's campaign prodded the federal government to act. The U.S. Food and Drug Administration is now reassessing rules for over-the-counter cough and cold medicines for all kids. A local government official who improves his own community has done something important. Ones like Sharfstein, who bring about progress nationwide, are incredibly rare. For that reason, and because of his efforts to literally save the lives of children, tonight we honor Josh Sharfstein as a Public Official of the Year.
Thank you. I can't talk very long because I have to get back to Baltimore and check on the security of our internet databases. To Governing Magazine, I thank you very much for this award. I'm honored to congratulate the other winners tonight for their very distinguished public service. 3 years ago, this week, I was preparing for my job interview to lead the nation's oldest Department of Health. I drove around town asking everyone I could find, including academic experts, community leaders, my neighbors in Northwest Baltimore, my wife, who's an addiction medicine specialist, the same question: what are the opportunities for leaps forward for our city? And I heard about many different ideas: new approaches to fight substance abuse, new tests to assess HIV, new strategies to promote early childhood development. And the more I listened to these ideas, the more I realized that I was hearing more than words. I was hearing music. The music was that our city could not wait for progress. We couldn't wait for the federal government to do something. We couldn't wait for the state to do something, that there were ideas that needed to be implemented and that what they wanted is to see it happen now. And that attitude from all the people I talked to in Baltimore was what hooked me on the job, and still does. After the incredible experience I had of working on the staff of Congressman Henry Waxman in Washington, I've had the amazing fortune of working for 2 terrific mayors in Baltimore, Martin O'Malley, who's now our governor, and Sheila Dixon. Governor O'Malley understands the music of progress now, and not just because he's actually a rock musician. Mayor Dixon's deep understanding and unflagging support of public health inspires me every day to take on our biggest challenges. I've also been blessed to work with an amazing team led by Michelle Spencer, our Chief of Staff, who's here tonight. When I started in December 2005, I assembled Michelle and their senior staff and told them I was worried about January 1st. Because on January 1st, 2006, about 30,000 vulnerable city residents were due to lose their prescription drug coverage in the Medicaid program and transfer over to the new federal program, Medicare Part D. And the staff responded. Within 2 weeks, we set up a 24-hour response system to back up our city's pharmacies during the transition, and I was sharing in the overnight call. I remember being on the phone with one woman crying in the background as the pharmacist was explaining to me that he couldn't give her her essential asthma medications. And because of the program we set up, I was able to say, don't worry, the city will cover the cost. And we were able to help hundreds of the most vulnerable city residents during that transition. Over the last 3 years, I've had the support of incredible institutions, organizations, and citizens in Baltimore, and I think the cough and cold effort really exemplifies this. This started not just by something we did in the health department. It started with a statement that we drafted with a professor from Hopkins. We then got every pediatric chief in the city, I think there were 9 of them, all enthusiastically endorsed, urging parents not to give medicines that were unproven and potentially unsafe to their children. And this eventually led to a petition to the Food and Drug Administration, a petition that would never have succeeded if it were just my petition. It was a petition of some of the top leaders in Baltimore and around the country. And I remember being in a room with about as many people as here tonight. There were only 4 of us who were there supporting the petition. It was an FDA advisory committee meeting, and everybody else was on the other side. And at one point during the meeting, when the advisors were debating what to do, whether to agree with our petition or not, someone got up and said that if you took these medicines off the market, it would cause the public health crisis of too many kids being taken to their doctor because they were, the parents wouldn't know what to do, so it would lead to crowded clinics. And I was able to get up and say, hold on a second, I'm the health commissioner of Baltimore. I stood shoulder to shoulder with 6 chiefs of pediatrics, and they said that if your child is sick, we want to see them if you're worried about your child. That's what public health is. We don't want you taking unproven and potentially unsafe medicines. We don't want more kids in Baltimore to die. The public health issue is not that the clinics would get a little bit more crowded. We want the clinics to be crowded in Baltimore. The public health issue is keeping kids safe. And I think that ultimately that advisory committee voted with us. It led the industry to pull the medicines, not just for kids under 2, but now for kids under 4. And I think it really was the combined effort, the support, and the energy that we got from Baltimore that made that happen. So I really appreciate this award, not so much because of how it reflects on me, but because of how it reflects on the people I have worked for, the people I work with, and the people I serve in Baltimore. They're the ones setting the music, and I'm just trying to play along. Thank you very much.